those no longer exist. Anytime they make changes, don't tell us. I'm gonna have to send you guys an announcement. Katie from the other class, she sent me an email as a reminder. Because if I have a conversation with you, I'll forget it. I mean, there's so many for the day. It's like when you're at work, in nursing, I write down everything. Because I don't wanna forget it then. Because there's gonna be so many things hitting me left and right. So 3 and 4 are no longer there. I will tell you what we did. Did I have this for one other semester? Yeah. And I'll see what I gave them. And I think what I replaced this with is going to be stuff like, what was it? Critical care drugs or something like that. But I'll let you know, okay? I'll definitely let you know. What was the other thing I wanted to? Oh, yes. I think about you all the time. And this morning, I don't know why these things pop into my head, but over the years, we know from students who have taken the boards, you know, they say, they go, hey, I was kind of freaking out because there was a disease on there that I'd never seen. I say, you're gonna see that, right? We don't know what's on the boards, right? We know the basic concepts, the basic diseases, but you're gonna see a disease that you've never heard of. Maybe like von Willebrand or something. And you're gonna freak out for about a minute, no, a second. But yeah, not a minute, because that's too long. What you're really needing to look for in that question is the concept, right? What are they actually asking you? And if there's assessment findings, that's what you're going to look at. The concept, like hypovolemia, it may be like, I don't know, something that bleeds, like von Willebrand, but that's not what the question is about at all. It's not even about that disease. It's about hypovolemia, as evident by the hypotension. You see where I'm going with that? And then, yeah, so you look at your assessment rating and the actual what they're asking. That's the first part of good deconstruction of questions, is finding out what are they actually asking, right? And then for farm, you look at the classifications. You look at those word roots, like, oh, that's in a law. Like an oddball one is like placentapril. What do? We look at lisinopril. That's what we commonly see. But you're gonna see betalol or something like that, which is still in a law or a prill. Oh, it's a prill. I know all about that classification. So that's exactly what you do. Not only do you look at the word root, figure out what it is, that odd drug that they put on there. It's all about knowing the classifications and the word roots, but also the context. It'll tell you it could be about low blood pressure, could be about high blood pressure, could be about anything. So yeah, this is just something that I said I really need to reiterate to students. It's always been there, I just have to remember to tell you. So I thought about it this morning. Okay, do you know what necrotizing fasciitis is?
Flesh-eating bacteria. Flesh-eating bacteria.
What is it?
Flesh-eating bacteria.
Okay. Yes. Okay, I'm putting this on your test because I really need to do this. It's on your study guide. It's on your study. Yes. I think it's at the bottom. So that's exactly right. It's caused by a flesh-eating bacteria. And which bacteria is that?
Strep.
Yep. Strep. Beta hemolytic strep. It is flesh-eating. So there's a couple characteristics about it. So you could get a little cut in your leg. What is the major, to get this answer right, what's the major characteristic?
Infection.
It's infection. So there, it's red. Yeah, so it looks like this. And I'm going to leave this off until we come up with it as a group. Is it a high febrile state? The white count's probably way up. Let's see.
Diarrhea.
Yeah, because of probably breakdown of protein. The characteristic and the way it behaves, it's very rapid moving. That's what you need to know about neck back. Is it starts from one area, and then before you know it, within a half hour, you start to see that inflammation, that redness, as go up or down or whatever on whatever body part it is. So that's the problem with necrotizing fasciitis. And then, of course, the other problem is in the name, which is necrotizing. Can you live with anything necrotic on your body? They could kill you, right? The toxins from the necrotic tissue plus sepsis can kill you. It's an infectious process. But really, are you guys starting to make the matchy-match connections with certain diseases? And I know that's a good place to be. Because you don't have to relearn a whole bunch of new stuff about that disease or med. It's matchy-matchy. If you're getting to that point, you are doing good. You are making connections and it's all coming together. So this is a matchy-matchy thing. So they have a high temp, and the reddened area, that inflamed area, is moving rapidly on whatever body part it is here. That's how you can tell it's fasciitis. Yeah. Okay, what's your treatment? Easy.
Antibiotics.
Antibiotics. Yeah, it's infectious. Are they going to consult infectious disease? Yes. Any? Huh? Oh, you mean the necrotic tissue, debridements and stuff? Oh, absolutely. So they're going to have to go in for surgical debridement. Oh, God, yes. Yeah. So your part is going to be give that. I'm talking about all of it right away. Time is of the essence because of the rapid moving. Is that my phone? You know what's going to happen? I'm going to throw this up against the wall. Just kidding. Oh my gosh, I really do not like it comes in with a fracture. Are you just going to be, whatever. What you going to do with that one? Oh, I'm going to be more specific actually, because this is a different question. They have a femur fracture. I know what question this is. They have a femur fracture. When you hear femur or pelvis, is that going to be that matchy-matchy connection? What is it? That in the line. That's it. You see where I'm going with nursing? All this stuff is so easy. That's a big matchy-matchy. When I have a patient who has a femur fracture, pelvic, what's the first question? Could they have a fat in the line? So that's a matchy-matchy thing there. Teach us about what you know. What does it look like clinically? Hypoxemia. Ooh. Okay, so we have hypoxemia. We have nerve. Why hypoxemia? Is it like a clot? It's a pneumonia. So it presents very much like a PE without so much pain as a PE involved, right? But what causes the neurologic stuff? Just some of those globules go up to the cerebral circulation? It really does. So you can get little tiny micro clogs up in the brain, and they can suddenly be super confused. That in the line. And here's another matchy-matchy. Oh, the petechiae. That's it. The petechiae goes with fat in the line. See how easy? You make those connections. When you set for your board, you're going to go, I got this. You know, remember flail chest, paradoxical lung movement. You know, if you see that in your stand, it's like, that's got to be a flail chest. Digoxin, pulse less than 60. See, it all starts to come together, and that's how you're going to be successful and confident with your testing. Okay, very, very good. So the findings, femur fracture, pelvic, the long bones, could be a humerus, right? hypoxemia, neurologic abnormality, petechial rash, mostly on the torso. That's another defining characteristic, very specific. What do you expect to happen? Is happening. That's going to be a fat in the leg. Oh, there's one other thing, and please write this down. I always do current research just to make sure it's still right. Is there one other very deadly thing that it could cause? Sir, good, yes. It could cause a systemic inflammatory reaction. We know that that equates to widespread vasodilation and capillary leak. Actually, that's the part that could kill them. Absolutely. So, good. And I'll probably, that looks like a, is that a selective? Oh, it's probably going to be in the stem, but you still need to know that, right? As another Frank's characters. Are there Indian questions? How many? Are there?
For MGM?
Yeah.
I thought there was only 5 on my list. I feel like there was usually 5.
There's
It says
5
two.
exercises.
It says motor vehicle and pick-on.
Yep. And I didn't know I had written that until I
Oh,
opened
I'm
it.
sorry, I thought you meant on your test. I thought you meant 2 on our test.
The one coming up specifically is going to be 2 NGN. They're already on your study guide. Big line and NBC, correct? And a drop-down closed question. If I add any more, I'm gonna tell you, of course. That's just because that's what I do for you. I do it for you. I can't relax until things are taken care
Did you
of.
say MVC?
Motor vehicle crash?
And then pick
Oh, do you know what that means? Motor vehicle, it used to be called NBA, motor vehicle accident. And then of course, according to, what do you call it, DOT, Department, what is that?
Department of Transportation?
Yeah, my ex worked for DOT, he was an engineer for DOT. He says, yeah, we call them crashes now. I said, okay, it's caught up in the literature of medicine, is that interesting? They call it motor vehicle crash versus human accident. Yeah, very interesting. He taught me that. So yeah, you're right. What do we have now? Oh, okay. Here we go. Are we ready? You may or may not know this, actually. But snake bites. We're going to talk about general findings for snake bites, right? So for snake bites, let's do this. Hypotension. A lot of the venom will cause hypotension. But when a guy or gal comes in with a snake bite, you know, I think about people building houses and people who work around, I don't know, out in the field or whatever. You have venom in the arm or leg. What position are you going to have that arm or leg in? Dependent. And what is it? That's exactly right. So you don't want that, you don't want it way up here, because what's going to happen? It's going to have that more powerful gravity and venous return. So yeah, place the extremity in dependent position. And is there something else that you want to watch for and assess for?
Okay.
Level of consciousness?
All of that. But how about swelling? And then, now, we're gonna talk about something coming up. When you see swelling, for whatever reason, you as the great nurse you're gonna be, what are you thinking about? That this could be an amputation secondary to what?
Tissue necrosis,
Secondary to what?
infection, infarction.
Lack of
It's
tissue
swollen
perfusion.
like crazy. Compartment syndrome, done, end of story. See the matchies? Swelling could lead to compartment, and it doesn't matter what the swelling is for. It could be a broken ankle, it could be any musculoskeletal trauma, fractures, i.e. It could be, even burns, compartment syndrome. I'm gonna show you the slides later. So that's what you wanna think when you see that big old foot that's pale. Cool, all the P's, right? PPPs. We'll go through that today. Well, same thing for this. This is not only that dependent situation, it's got the venom not coming in. And you don't want to elevate it to further cut off circulation, that arterial outflow, right? So, yeah, we do not like big, swollen anything. Yeah, just even with the heart. Yeah. Yeah. I'm glad she's okay. Okay, where were we? Okay, yeah, so, who's next? Hello, okay, let's see what we have now. Oh, this is our post-surgical day. Okay, good. And who answered it earlier? They actually did a fabulous job. Okay, post-surgically. So, why do we call it the post-surgical condition? It's abnormal. They do their magic intraoperatively, like they'll do their plumbing or they'll fix or ectomy something out. But guess what? That's not what's gonna kill them, is it? Zero is broken. So what's gonna kill them are all your post-surgical complications. So see how many you can name. And let's start with the life-threatening stuff, because that's what we really care about, right? Oh, pneumonia, look.
Because they're the most common shocks, thrombosis, virus, obstruction,
Ooh.
infection, hemorrhage, stroke, delirium.
Would you want that one picture?
Yeah.
That one picture? Did you get that out of Canvas? Okay, yeah, I don't know if D1 has that. We were talking about that very picture this morning. And let's add some atelectasis. Very good.
What's that for the
Oh, yeah, atelectasis. Okay, so I have pneumonia, I have UTI, thrombus, small bowel obstruction, infection, hemorrhage, stroke, atelectasis, PE. Oh, yes, I have a test question on this. So dehiscence. And what's the other one where the guts come out? Evisceration. Have you ever heard, like, I don't know, when there's something on TV and they go, I'm gonna eviscerate you. Well, what that means is they're gonna reach in and they're gonna pull out their guts. That's not a good thing. So let's do this. Let's see which one we're gonna talk about here. And if she has it, y'all have it, right? It's a picture of a guy laying in bed. It's a really basic picture, right? Oh, no. Where'd you find it? Yeah, because most of my stuff did not translate over. That's why I'm having
Did
to
you
read.
use when you put it with me?
Oh, yeah, Katie did say the first day I did bring it. Yes. Yeah. Yeah, she's right. I did. So it's a picture. So you should have that in your book there. Yeah. Yeah, I totally forgot. Okay, so speaking of evisceration, does this happen in obese patients? That's who it usually happens on. The fatty layer pushes out the guts. It really, really does. Either to the side, it causes so much pressure. Like if you know, in GSU, that's the majority of folks that I've seen. They have abdominal surgery. Those are the ones who usually eviscerate. And they also have hernias too. Everything gets pushed out. Yeah, they do. So you're working on a general surgical unit, or they get into the ED. Well, surgically, from a week ago, I'm like, kind of like, oh, they say, oh, my gut spilled out. And you're like, oh, that sounds like an evisceration. So what are your exact first interventions going to be? That's correct. Sterile saline or even sterile water gauze put on that. Because why? That's right. You don't want tissues to dry out because dry tissue that should not be dry will die. We don't want any necrotic tissue. So that's what you do. It's that simple. So pack them a little bit, call the doc and say, it looks like we have a post-surgical evisceration, and go ahead and tell the doc their vitals, right? And also tell them what you did for them. You probably have a protocol. I know ED has all kinds of protocols. But up on the post-surgical unit, you should have a protocol up there too. Oh my gosh, yes. Not only do they serve fresh post-surgicals, but complications they come in. Those are the worst. You know why? Because they're mostly infected. These bellies like this, it's full of pus, purulent drainage, and then guess what kind of drain do they put to them? Penrose. Do you know what a Penrose drain is? It drains to the outside. So guess what your job is for that day? Are you gonna have chucks like crazy? Well, they're gonna be draining the stinky, purulent stuff. It's the grossest thing you've ever seen. So make sure if you're a gagger, if you wear a mask, put some toothpaste in there so you don't have to smell that crap. They already know that they're infected because they've done swabs and samples and stuff. And if not, guess what? Will that be another thing that you need to do? Gotta do a little curettage, get in there, get some of that stuff, get a sample for CNS, a wound culture, of course. Good job. Okay, let's move up. We're still on post-surgical. I have actually quite a few post-surgicals up here. The reason that I don't have a lot of intra-op, what are some of the intra-op complications? What do y'all think? Maybe they hit a bleeder. You know, they might have found a bleeder in there, maybe some hemorrhage. Yep, heart and lungs. It's all about heart and lungs. Unrecognized hypoventilation is of all those meds that the anesthesiologist gave them. Under-recognized hypoventilation and heart issues. So that's why they have to do a clearance, a pre-surgical clearance for high-risk patients. And then they determine what risk they're at, low, moderate, or high risk for surgery, and specifically what kind of risk. And then, can the surgeon still take a chance? Do some of them do? They don't give a crap. They'll work on anything. And they take it in there. And those are the surgeons who we're always looking out post-surgically for a bad outcome. Every time. I'm telling you. Not every time, but frequently on those surgeons. Does that give us insight and privy to know if we ever have to have that type of surgery, who you want to go to and who you don't want? We're very lucky in that regard. Because otherwise, is it a crapshoot for patients? They don't know. They could get assigned to anybody could come to them. And we're saying, you have no idea. But of course, we're not going to say that because that would be unethical. Let's talk about, yes. Okay, so what are some of the typical treatment modalities for cancer? Let's keep it really simple. Chemo and radiation, right? Are there some other treatments, like some holistic treatments, and of course surgeries, ectomies, they can remove tumors, and then you have a bunch of other stuff holistically. But let's talk about mastectomy specifically. And there's reasons that I'd like to talk about it. So, when you see them post-surgically, what will you see? Yes, and lots of green.
Is that the one where they remove?
Yeah, mastectomy. Say like they have bilateral or whatever.
I had a patient on Saturday who had a mastectomy and then she was getting reconstruction.
Oh,
So
yes.
the nurse was explaining that they put a splint underneath her abdomen so that the skin stretches and they do a tummy tuck basically. And then use that skin to reconstruct.
That sounds so plastic. That's so
It
great.
was pretty cool to see.
Because you get the tummy part and then you get the booby part.
Yeah.
That is so cool.
The mommy makeover.
Yes,
But
that's
I
right.
think she had implants before.
Oh, sorry.
And she had complications.
Well, there's been so many complications. I mean, I can always tell if somebody has implants. Because the boobs are too perfect. They're like this, they're like perfect. And she looks down, she says, "You can?"
No, but she said
Yeah.
that she had the complications when she had her implants removed.
Yeah. They can be really complicated. Well, they come back with a brace. They come back with, if they had it for cancer, for example. So not only did they do lymphdectomy, they had to remove lymph. So there's less possibility of metastasis. So when they remove the lymph, what is the problem with that, with the arm? Lymphedema. Now for nurses, what are the interventions for lymphedema? That's right. Ooh, very good. You can't do the blood pressure on either arm if it's bilateral, ankle or something, Good. That's a good intervention. And then do they have to wear tight compression stockings? Even tighter than Ted. I'm really bad with compression stockings. These especially, those are hard to put on. You know who's really good with compression stockings? Tex. Oh my God, they're with the legs and the arms. I go do it. I'm lousy at this. I'm sweating and I'm hurting the patient. Oh, I know. They're so hard, but the Tex, they have it down because they put so many Teds on it. Yeah, I don't either. I'm really lousy at that. Anyway, so what is the purpose? Why do we have to put those compression stockings on their upper body?
Blood flow.
Because if you take out lymph, it's like a venous system. You are now missing that venous, that lymphatic return to the heart. They both go to the heart. Other than arterial is outflow, this is return. So you're going to have it end up in your arms, and lymphedema is horrible. So that's why we have to have the milking of the lymph into the heart. They have to use them pretty much all the time. I don't even know if they take them off at night, but yeah, for the most part, they have to wear them a lot. What was the other thing? Oh yeah, and then the binding here, and that's to keep the swelling, the bleeding down, and press fluid where it needs to go. And the drains. Let's talk about those drains. Oh, so when you go into Epic, first of all, I know, what kind of drain is it? You guys know? JP. Yeah, so it's like a hand grenade. Yeah, it's not the big hemovac that you would use for like a joint replacement or something like that. They look like little hand grenades. How do you get the suction out of those? Yes, you make it look like an oval red blood cell because it has a divot in there, and then so you press it and then you stop it or put the top on, right? And then you let it go and it should be in that shape. That shows you it's very gentle suction. But what's most remarkable about mastectomies is you probably have 3 on this side and 3 on this side. So in Epic or McKesson, your charging is going to have, you're going to have to label those number 1, 2, 3, 4, 5, 6. Because can you have a bleeder over here and over here nothing? So from a legal standpoint, you really have to quantify them perfectly. Yeah. And if you have one that like post-op an hour that fills up right away, are you gonna call the doc? Yeah, let them know. Look for signs and symptoms of hypovolemia, really. And then let the doc know what the vital signs are. And what they're probably gonna have you do is continue, they might have you draw an HLH at that point, because it could be enough to warrant a blood transfusion, depending on the HLH. So it's just an abnormal finding. But yeah, that's what you do. Can I tell you one other thing before we move on? Is there a psychosocial issue with this situation?
Yes.
Can I tell you a story? What happened to me over there at Caseland? Also had some radiation, and then she had her mastectomy. Now, Erin when you take care of a patient with external beam radiation, that means from the outside, oftentimes they'll have that plus sign that directs that radiation to that specific part. Sometimes those plus signs on their body are permanent, right? They tattoo it, yeah. Some places will do that. I'm not sure which places, but I've read in the literature, yeah. So, with the irradiated skin, how are you gonna treat that skin? Oh, don't do what? Heat. Heat's a good thing. So don't apply any warm water or alcohol. That's exactly right. Anything that is caustic to that area. Now, hospitals are mindful of this, and therefore what they do is their products are, is it already 51? Oh my God. They know what products to use that are non-caustic, like the soaps and things. Okay, the list is full.